Set aside as National Arthritis Awareness Month. It's a time to spread the message about prevention and treatment of arthritis, a disease that affects over 50 million Americans. Here to tell us about some of the symptoms and ways to prevent and treat those symptoms, Dr. Jody Sengstock, the director of the Professional Relations Department for the Michigan Podiatric Medical Association. A lot of big medical words, I know, for the podiatric. So when we think of arthritis, I know I often think of arthritis as something that might happen to my joints when I get older, but is it age related or could it happen to anyone?
It can happen to anyone. The most common age group is around 50, but if you have an injury, especially as a child, while the growth plates are still active, then you can have arthritis earlier.
Okay, so arthritis, I think probably it's pretty commonly thought of as being in the joints, but what exactly is it?
So it is inflammation of the lining of the joints and the cartilage. That's exactly what arthritis is, and it can be in any joint, whether it's the littlest toe to your shoulder to your hips.
Okay, are there pains that sometimes people have that they don't realize is arthritis, or do people sometimes on the opposite end think they have arthritis, but maybe it's something else? How do you know?
When you have an ache or a pain, it's sometimes hard to tell unless you go see someone and have tests run, whether it's a muscle or if it's the joint. So we have to assess that, and we can do that by taking x-rays, doing an exam, taking a history.
Okay, and some of the symptoms you had mentioned: early morning stiffness, limitation in actual movement, pain, and actual skin changes in your skin?
There are some arthritis, such as psoriatic arthritis or psoriasis, which is a skin disease, but it can have arthritis associated with it.
Okay, now there are different types of arthritis. That's something else. It's a lot more complicated than people realize.
Yes. So the most common ones that people will probably know is the wear and tear arthritis, which is osteoarthritis. That's the one that tends to be age-related and activity-related. The other ones are post-traumatic arthritis, which I mentioned earlier. If you had an injury to a joint, then you can get arthritis in that joint. And then also rheumatoid arthritis. That's an autoimmune disease.
Yeah. So what can you do to alleviate some of these symptoms? Is there anything you can do to feel better?
Absolutely. So first of all, as far as any arthritis goes, but especially osteoarthritis, weight gain definitely is associated with more joint pain, because the more weight you have on the joint, the more pain you're going to have with that joint. Anti-inflammatories, whether it be by mouth or an injection to the joint or something topically put on, can help quite a bit. If you have inflammation with the joint, then that will also cause pain.
Yes. Thank you so much. We so appreciate your time here, and I know diet impacts things as well. We'll have more information on our website. We'll be right back with a news update.